Hey, what is up, you guys? Welcome to another day with Spencer here on my personal channel, and I am currently 23 days post-op surgery with Dr. Doolin in Plano, Texas. I got double incision bilateral mastectomy with lipo, and I am also I'm 8 days post-complication with the allergic reaction I had to the steri strips. So I'm just going to let you guys know a little bit of what they have me on, how it feels, what it looks like now, and what to expect in the future. So currently what they have me on is roughly about 16 different medications, or at least that's what I'm taking in total. All of those meds don't have to do with the allergic reaction. I just take medicine as a human being to exist. So some of them are gabapentin, 2% hydrocortisone cream, Vaseline coconut oil, bacitracin, Valium, Vicodin, and Arnica montana, which is like, I call it hippie medication, probably not the best word to use, but it's a natural remedy. So I'll show you my chest in a minute, but I just want to explain how I'm feeling and what's been going on with the complication that I have. So if you don't know, I have a allergic reaction, a severe allergic reaction to the steri strips that Dr. Doolin placed on my chest after reveal. So though I'm 23 days post-op, I'm only 8 days post reaction because the steri strips only went on my chest on April 18th. He was using a different type of tape, surgical tape, I don't really know what it was, before he put the steri strips on, and my skin did not react to that. So, you know, it was just shit luck, and we're dealing with it. We're 5 days into dealing with it, and it's, yeah, it's been a ride. So, let's talk about comfort first. Comfort-wise, I'm very uncomfortable. One of the problems that comes with this reaction is I can't place anything over my incisions. So no silicone gel, no silicone strips, nothing, no gauze, nothing like that can be placed over my incisions because I can't have any friction or anything with fibrous material. The only thing that could be placed over my incision is something known as Adaptec, but Adaptec is only adhesive to gels and creams, and once the hydrocortisone and Vaseline or coconut oil, whatever I'm using, evaporates, it just falls off. So it doesn't really help, and it doesn't really stay on. So currently there is nothing that can be placed along my incision line. The issue that I have with that is the constant friction of wearing shirts like these, or even just cotton shirts along those incision lines create and make the incisions very itchy. And sometimes even like too itchy to where the hydrocortisone cream doesn't really help. So they're constantly being irritated by clothing, which is inevitable because I have to wear clothing because I have to work, and that's been a battle that we've been trying to beat. And honestly, I think I'm on the mend right now because it's not as itchy. I used to have to apply hydrocortisone every 3 hours. Now I'm down to like once every 8 hours, so hopefully it seems like it's getting better and we're gonna get this allergic reaction under control. The next thing is nerve endings. So it's pretty common to have nerve pain after this type of surgery, or really any type of surgery. Once your epidermis, dermis, and subcutaneous layers of your skin is cut, the nerves are cut and they have to grow back together. It can take anywhere from like a couple of weeks to a couple of months for them to grow back together. Some people experience like a sleepiness, like when your foot is tired, that type of tingling sensation, to a burning sensation. What they have guesstimated, I guess, is that because I've had this reaction and the inflammation that comes from an allergic reaction, my nerves kind of are hypersensitive to everything that's going on. So I've experienced a lot of nerve pain when it comes to my incision lines, and that's been incredibly uncomfortable, which is why I'm on gabapentin, which is to help with the nerve pain. And then lastly, just, you know, the hypertrophic scarring has just been a constant battle. There's no difference in appearance, as you're going to soon see, and it's really disheartening to just continue throughout the day applying all these salves and taking all these medications and doing all these things and not being able to see, or not being expected to see, any change for at least a couple of months. So I'm like kind of not in the best headspace at the moment, and it's really hard to stay in a good headspace when it comes to battling this type of complication, because it's not something as simple as a seroma or hematoma where you literally go and get it drained and it's fixed. It's something that takes months to years to correct, if it's going to correct itself at all. So I'm going to go ahead and show you my incisions and show you what it looks like now, 8 days after, is it 8 or 5? August 18th to now, after, we've started treatment on it. Alright, so this is what my chest looks 25 days post-op, and 8 days after treatment. It's still super hypertrophic. Let's see if I can lower this. Still super dark, as you can see. There's nothing oozing or anything. You can see these are stitches. This isn't anything to worry about coming from the sides anymore. This is new skin coming through, so you can see this is kind of like my skin cone, but everything else is still super dark and super raised, and just super hideous, really. This is the contouring of my chest is pretty perfect, and that's like one thing that I love about my chest, is that it does look pretty masculine and pretty perfect, and I don't have any excess swelling or anything, like up here and stuff. It's just these fucking scars are just killing me. My scars aren't long, which is great. They don't really go even past the armpit. So that's something that I really am happy about. And my chest is super flat. As you see, my chest is flat. This tape keeps coming on. I need to put a new here. But my chest is flat. So, like, all in all, like, the procedure went great. It's just the fucking allergic reaction that we're dealing with. So a lot of people have been trying to send me, like, oh, this looks like regular scarring, this looks like regular top surgery results, and it really doesn't. It's really not, and it's like really disheartening. I don't know, I just kind of like, I appreciate the positive vibes that I'm getting from the internet, but also like comparing this to like a typical top surgery result is unfair. This is not a typical top surgery result. One of the things that I'm struggling with the most with this result is the fact that essentially, but most of the people who've had top surgery and don't have any complications have this grace period of anywhere from 3 to 5 months where their scars are straight and small and not raised, and they get to take as many selfies and be shirtless as often as they want to and have perfect incisions. And then after that grace period, you go into like the problems with scarring and stretching and all this other stuff. But there's a grace period where your chest looks perfect, and that's right after surgery, right after that 6-week mark, when you feel great, when you can do everything you could do before, and your incisions haven't stretched yet, and everything just looks great. I kind of feel like I've been robbed of that experience, because the thing is, no matter how long it takes for this hypertrophic reaction to fade, it will never be as clean as it was that time that you guys saw when Dr. Doolin showed me my chest for the first time. And I only have those 5 pictures and that one video from what my chest looked like perfect. And it sucks because I've had a lot of things that I wanted to do topless that I'm not going to be able to do. Like, for my birthday, I was planning to go to Orlando to go to Harry Potter World, as well as their new water park shirtless. And I can't do that with these scars. I'm a lifeguard, I can't aeronautic, I can't be shirtless with these scars. And like, I'm saying I can't, not in the sense that they physically won't let me, I'm saying I can't because I'm not comfortable. And it's unfair. And I am dealing with a lot of jealousy with that, and I'm dealing with a lot of anger with that, and I'm dealing with a lot of just having to accept the fact that I got a raw deal. It's really just hard to wrap my head around, it's really hard to move forward because I shouldn't have these scars 23 days post-op. And it's just how it is. But now that I've, been depressing, let's talk about what the future holds and how we could possibly get this fixed. So there's 3 methods that they've offered me thus far. The first is to allow natural progression of healing. Hopefully, with the allergic reaction gone, the skin will stop freaking out and send less pigment to this area, which will cause the scars to lighten on their own, and it'll look back to like a typical incision. That can take months to years, and it may also not happen. Hyperpigmentation is one of the hardest things to get out of black or people of color incisions and scars, It's what makes our scars so much darker and visible compared to our white siblings, and it's a recurring problem when it comes to any type of surgery or scrape. Hyperkeratosis is something that happens to a lot of people of color. So the hope that it fades on its own, from my understanding, is slim to none. The second thing that we have is skin bleaching and skin lightening creams. So think of your Sammy Sosa or your Michael Jackson. It's basically pigment targeted creams that will, I don't really know how it works. I don't know if it like eats the melanin or kills the melanin, or dissolves the melanin. I don't really know how they work, but they do something to where they take the melanin away from the skin to lighten it. Now, skin lightening and skin bleaching are two different processes. One is with kojic acid, just from what I understanding, that's skin lightening. I don't really know the difference between the two. One is a little more risky than the other, but with hyperpigmented scars, I think a combination of both is what has to be done. So that, honestly, to be honest with you, is probably the route I will be taking once my scars have been healed enough to start skin bleaching and skin lightening, etc. And the third and final one is a complete scar revision. So they would go back in, they cut all this hypertrophic skin off, and they'll resuture, they'll inject with cortisone, steroids every so often to prevent it from happening, and they won't like secure me with steri strips, and then I wouldn't have a reaction to begin with. So those are the three options that they've offered thus far. This is what it looks like. 5 to 8 days with treatment. I mean, it looks better in the sense that there's not shit oozing out of it anymore, and it's dry and looks hydrated and stuff, but, you know, the under the arms are still kind of problematic. It's still pretty big and pretty raised. This one is healing fine, but just looks like it's not. I don't know. It just like, the black line in the middle is the actual incision, and then you can see the skin color coming back and the pigment receding. So, I don't know. I don't know what's in store for me. I don't know how long this is going to take, and I understand everyone's telling me to be patient, but it's really hard to be patient. It's really hard to be patient when treatments are like months to years away, you know? This isn't like, oh, you can bind and be fine and then get top surgery and everything is magically better. This is like months and months and months away, especially since I'm going to be losing my insurance in a month, so now everything in a month will be out of pocket until I get on insurance, which isn't going to be as good as my parents' insurance, which is still going to be a nightmare. So there's a lot going on. There's a lot riding on this, and yeah, I have a lot to think about. So I hope you guys are having a great week and are getting it for an even better weekend. I'm taking a hiatus from social media, so, you know, if you have my number, hit me up. Other than that, you know, look forward for these updates. I'll try to do it once a week. It's Spencer. Until next time.